Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professions education. Now, I'll point out to you in this series what's important, what's not so important. So, let's go right to it. Now, in assessment, we need to start by asking ourselves, what is it that we want to assess? What is it that we want to measure? Now, if I enter a tool shop and I tell them I want a tool, so the logical question that we will be asked is that what is it that you want to do with your tool? So the same thing with assessment, and also in the health professions assessment, that we need to ask ourselves, what is it that we want to measure? Now, thankfully, people have thought about it, have given a great deal of thought about what is it that we are measuring in health personnel, in health sciences personnel, in doctors, in pharmacists, in nurses, and so on and so forth. Now, one of the most useful and often cited description of what is it that we are measuring is called the Miller's pyramid. Now, that's the whole purpose of the next section, which is George Miller's pyramid. It describes clinical competence, the contents of clinical competence in a form of a pyramid. As you read there, it says it's a useful model or taxonomy of the levels of knowledge and skills assessed in health professions education. Now you can see it in figure 1.1 that it is a pyramid where you see cognitive knowledge is at the base, meaning that the foundation of clinical competence is knowledge. You have to know things first before you are able to become expert in it, and before you're able to do something about it, you must know first, and that is cognitive knowledge. That is the nose level, as described by in this section. This is the nose level of essential factual knowledge, the knowledge of biological processes and scientific principles on which most of the more complex learning rests. Again, this is the nose level of essential factual knowledge, the knowledge of biological processes and scientific principles on which most of the more complex learnings rest. This is the basic level, the foundation knowledge, on which other knowledge which are more complicated, they are built upon this knowledge. Okay, knowledge is the essential prerequisite for almost all the other types of learning expected of our learners. Okay, and if you link that, if you say if that is the thing that we want to measure, then you think of how you want to measure that, and the nose level of the Miller's pyramid is often said to be best measured by written objective tests. You talk about your MCQs, your essays, and things like that. So we see now the link between the levels of what and the how. The what and the how. So the what is the first is the nose level, and when you talk about nose level, how you want to measure it is by most often and best measured by best assessed by the written measurement tools. Now above the nose level is the nose how level. It adds a level of complexity to the cognitive scheme, indicating something more than simple recall or recognition of factual knowledge. The knows how level indicates a learner's ability to manipulate knowledge in some useful way, etc., etc. Okay, this is the application level, if you say if you may say that. Okay, what is called as the HOTS, I suppose, the higher order thinking skills. Now, if you correlate these two levels, the nose and nose how level, uh, the nose level is the LOTS, the lower order thinking skills, basic memorization skills, founding blocks. But as you go to the nose how level, you start to think about how knowledge is applied. How do you apply that knowledge? For example, the nose level, you know what is the content of the carpal tunnel, for example. What nerves go through, what vessels go through, what other structures go through. But when you go to the knows how level, you can apply that knowledge and you can explain how carpal tunnel syndrome develops, for example. Now that is the knows how level. And again, if you think of how best to assess that level, uh, it says here, this level can also be assessed quite adequately with carefully crafted written tests. Okay, although some health professions educators would tend to use other methods such as oral exams or other types of more subjective observational procedures, but it's best assessed again still by written tests. So we say that the nose and the nose how level is the domain in terms of how to assess them, is the area of the written assessment tools. You talk about single best answer questions. You talk about the KFQs. You talk about the scenario based questions. You talk about the short answer. You talk a lot of things, but they are still written methods of assessment. Okay. Uh, The knows how level deals with cognitive knowledge, but is but at a somewhat more complex or higher level than the nose level. The first two levels of the Miller pyramid are concerned with knowledge that is verbally mediated. The emphasis is on verbal type knowledge and the learner's ability to describe this knowledge verbally rather than on doing. So knows and knows how level. So you're going up. As you go up, the competency increases, and we are still using paper-based assessment at the knows how. Then the third level now is the shows how level. Moves the methods of assessment to performance tests. And we will discuss it later in another class. We have one class on written tests. We have another class on performance tests, in which one directly observes learner ability to translate knowledge into practice. Okay, so shows how is where they show, where they perform. Okay, but at the shows how level, all performance exams are somewhat artificial. It is constructed. They do it with models, with uh, trained patients. So it is not a real life situation. It is a contrived situation, and the word that people use is that it is an in vitro assessment, something that you construct. Uh, Okay, simulation-based assessments, such as a simulated patient encounter to assess communication skills, are good examples of the shows how level of assessment. Okay, so this is uh, the standardization procedures add to the measurement qualities of the assessment, but may detract somewhat from the authenticity of it. So now you are seeing that as we go up the pyramid from the nose to the nose how. We're still using paper-based assessments, but the reality or rather the realism of your assessment becomes more and more they become more and more authentic. For example, in the nose level, you can just ask, list the contents of the carpal tunnel, or you can have an MCQ on that. But as you go up the nose how, you talk about a patient, you talk about a disease, and perhaps you can give a question in which a patient complains of signs and symptoms of carpal tunnel syndrome, and you can ask a student to list the most likely diagnosis, for example, or to choose the most likely diagnosis. So it becomes more realistic now. But the further up you go, you go to the shows how level. It becomes more realistic. You can call in a patient or a simulated patient, and you can ask the student, can you please show me how you would examine this patient's carpal tunnel? So it becomes more and more more and more realistic. So the higher you go, the more authentic is the assessment, the higher the competence level. Okay, so we are at the shows how. Now we are going to the final level, the Miller's dust level. Now this is associated with more independent and free-range observations of the learner's performance in actual patient or clinical settings. The word is actual patient or clinical settings, known as work-based assessment. That's a big group, a big concept, a big thing in assessment, as we will see later. Workplace-based assessment. Okay, because that is where we assess their actual day-to-day life performance. Uh, where Whereas in the previous level, the shows how level, we say it is an in vitro assessment because it is contrived, it is constructed, it is artificial to a certain degree, it is compartmentalized. But now at the dust level is the in vivo assessment, is the live assessment. It is where you see their day-to-day performance. Okay, and when you ask how to assess, we talk about the workplace-based assessment, which is based, a large part of it is based on observation by raters. Okay, so you start at the nose and nose how level. You are talking about paper-based assessments. As you go higher up, it becomes more authentic. You're talking about performance assessments. You're talking about OSCE. Okay, and you go at the highest level, which is the DUS level. You're talking about workplace-based assessment, and you're talking about observation-based assessments. Now that is the Miller's pyramid. It is useful because assessment planners can know at what level are we talking about, and therefore what are the methods best used to assess. Okay, and it links the what and the how. Okay, and it says here at the DUS level, some standardization and control of the assessment setting and situation is traded, is lost. But what we gain is complete, uncued authenticity of assessment. Okay, all right. So it says here, Miller's pyramid can be a useful framework to guide our thinking about teaching and assessment in health professions. But there are many other systems and or taxonomies of knowledge structure also discussed in the literature. Okay, for example, one of the oldest and most frequently used taxonomies of cognitive knowledge. Okay, so the knows and knows-how level of the Miller's pyramid is actually equal to this taxonomy, which is the Bloom's cognitive taxonomy. Okay, so Bloom's is another type of taxonomy, and especially for you candidates who are or who will be working in the Malaysian environment, education environment, we need to be familiar with the Bloom's taxonomy, because this is what is being used by the Ministry of Education for all its educational courses, including medicine. We in medicine courses are not separate. Although the medical education literature is or uses the Miller's pyramid more often, but here in Malaysia we are part of the Ministry of Health, the Ministry of Education Malaysia, and they use the Bloom's taxonomy as a reference. So you need to be familiar with the Bloom's taxonomy. And another description of what students will be able to do is the Malaysian Quality Framework document, which is known as the MQF version 2 learning outcomes, and that is also something that you need to be familiar with in terms of what is it that we want to assess or what is it that we want to measure.